Well, we're here with Dr. Kahan from Sacramento, actually from Carmichael. Let's get right to it. Dr. Kahan, you're a podiatrist, and tell us, Dr. Kahan, what can a patient expect when he comes into your practice, and which patient should be coming into your practice in the first place? Because even though we patients kind of say a podiatrist, everybody does the same, we kind of feel like that, but at the same time, we're not quite sure, and we want to match the personality a little bit. Tell us about it, and please tell us why you became a podiatrist, would you?
Yeah, I'd love to start with the reason of why I did become a podiatrist, and I guess depending on the field of medicine or what profession you chose. I mean, it was a personal experience with a podiatrist when I was younger. A simple problem such as an ingrown nail that caused me great pain. He took care of the issue very quickly. Within a few hours, I felt great. And not that I was headed that direction when I went into college, but a few years into college, thinking that I was going to switch directions from one medical field to another, and boy, that doctor evidently made a very deep impression on me. And having been involved with sports and being very athletically inclined and so on, I checked out the field of podiatry, and here I am 25 years later, practicing podiatry and helping athletes, as well as, we see kids as young as 4 to 6 months old for minor deformities, either birth-related or something, again, as simple as an ingrown toenail. And I have patients that are 96 years old, and they come in regularly for something as simple as trimming corns or calluses, or they can't trim their own nails, so we'll take care of that for them, and everything in between. Whether it's heel pain or arch pain, fractures, surgical or non-surgical care. Most podiatrists in California are trained and surgically trained in the foot. I happen to have an ankle license as well for this state. But one thing that I found early on was that many foot and ankle related conditions can be very well conservatively treated, 95% of those conditions. And so we concentrate on the non-surgical, aggressive, conservative care of many conditions. And as a result, we get great results as a result of that. And when surgery is necessary, we go down that path as needed. Fortunately, nowadays, technology is moving at a very rapid pace, so we've incorporated a number of lasers in our practice that can treat for lack of a better term, the gross, disgusting-looking, thick, discolored toenails and toenail fungus. We also treat with a second laser soft tissue injuries such as an ankle sprain, a muscle strain, a leg strain. Diabetics that may have a sore that's not healing well, that can also help with that. So as simple as the child who has no idea what's going on with their foot up to the 96-year-old, and the whole gamut of problems in between that we can treat conservatively, that's what we try to do.
Beautiful. So basically one of your main philosophies is, first of all, you're in there with conviction because you had your own, like, wow, I can be helped right away. It goes like bam. You can make an immediate impact on people. So you have your own conviction. This is wonderful to have a doctor who, is in it because he had benefited from this profession himself, very heavy and stuff. But so then what you try to do is, if possible, fix the problem non-surgical in a traditional way, or whatever you might want to call that, and that works well for you, and that works well for the patients. Patients like that, I assume. I don't know. They probably not looking forward to always get cut. And maybe that's why they sometimes don't go to a doctor. They go, oh, all he's going to tell me, cut it out, and I really don't want that, or whatever, right?
I absolutely. I get many patients that'll come in. They say, well, I either want a second opinion or even a third opinion. And the last two doctors said I needed surgery, and they're scared, afraid, whatever it may be. That's a very frequent occurrence. And so if there's any possibility that I can deal with their particular condition on a conservative basis, and unfortunately, this is one thing I still don't understand, is that a lot of doctors still, and not just podiatrists, I am not going to pick on any particular field of medicine, a lot of doctors want to bypass that conservative care that can be so critically helpful for somebody, and boom, jump right into that. Oh, you need surgery, let's go. That's not what the patients want to hear. You're correct. That's the last thing a patient wants to hear.
Well,
so we deal with that very well.
Yeah, and again, maybe, I mean, to give the doctors a little bit credit here, and sometimes one of the problem is that actually there is a certain amount, and it's probably a relatively high amount of patients. You see, we're living in a world where we want to have a beautiful romantic evening in a microwave second kind of time. Do you know what I mean? And it doesn't work. But we do, who wants to take vitamins to get rid of something? Who wants to go into nutrition and exercise when an injection can fix it? Kind of. Do you know what I mean? So some patients I want it fixed completely now. Just get me in, get me out, knock me off, and get me out. So sometimes I'm not so sure who is the bigger pusher of where you want to go. But obviously, and that's why I wanted to ask you and to talk about your philosophy, because for every philosophy out there are plenty of people who would want to like to be in that philosophy. So if people think that if I can avoid surgery, I would love to do so. Maybe it's because of price, because price has to have some impact with surgery, and also, of course, the fact to get cut. They would feel very comfy with you because you will know and are experienced about the options which fix it without surgery. Because the guy who only wants to do surgery, he probably isn't very good doing it without surgery. He can do it, he's a doctor, but he isn't working on it all the time. He hasn't explored all the ways on how it can be done, which is usually what it takes in medicine, to explore millions of ways, sometimes never taught in school, I suppose.
Yeah, absolutely, absolutely. I mean, that scenario when the patient comes in, and I treat every patient as if I'm dealing with a family member. I lay out every step, every possible treatment scenario, give them my personal opinion of what I feel obviously is best for them, that's my job. And if they decide that I would rather go a more aggressive route or a less aggressive route, that's not a problem. I mean, that's what medicine is. We are practicing medicine. We're not perfect, and there's many different ways to treat a particular ailment. And I'm more than happy to work in the direction that the patient wants to go. And again, most don't want surgery, but they want what can I do that's going to get me through this the quickest.
Wonderful. Thank you very much for telling us about your life, your story about how you become a podiatrist. Quite wonderful, and it's wonderful to see that a couple of years later anyway, you're still loving what you're doing. It's great. Thank you very much.
Thank you.